Hi friends, today we will discuss something related to the approach which is required when you go to your labor room postings in your college. So firstly, we'll see what are the cases which we see. Everyone knows in labor room the major things, the only thing which you see is labor, correct? So labor OT approach. Remember, it's just labor and not your, I'm not talking about the other part of it, that is the OT, where you have all this TH plus BSO. I'm not talking about that. We'll discuss about that in the later class. For today, it's just labor and what are the complications of labor and what are the types which you are going to see. So, if you see, firstly, we'll go to our usual things, that is stats. The only thing which you can see is your normal vaginal delivery and your C-sections. Okay. In your normal vaginal delivery, you can have a normal one without episiotomy or a normal with episiotomy. Okay. Then an assisted delivery. Okay. It can be vacuum assisted or forceps assisted. Okay. Now coming, this depends. Okay, based on your college and based on the patients you get. An exact statistics cannot be commented, but almost 40 to 50% can be vaginal and remaining can be your C-section. Okay, is that clear? So coming to that part, these are the things. In normal vaginal delivery, you can have a normal delivery or a normal delivery with episiotomy, or you can have an assisted vaginal delivery where assistance can be either via a vacuum or via a forceps. So there are certain indications when to use forceps and when to use vacuum. So if it's a prolonged stage, first you try using your vacuum. Then if you have a better control and if it's due to malnutrition, then you always use forceps. Okay. So this is one thing. And in coming to C-section, either you can have an elective C-section, that is, it's already planned, or you can have an emergency C-section, that is due to some complications you are doing that section at that point of time. Okay. Now if you go to your labor room as such, you can see if these are the rooms. You can also see if it's a complicated pregnancies or if it's an high risk pregnancies. Okay, they'll be operated in a different room. For example, in my college what I've seen is there is something called as PIH, that is preeclampsia room. Okay, so these are the, there you can have specific other drugs or some other instruments where it's going to help your delivery goes smoother. Okay, so these are the things which are there. So this is what you should know before going to your labor room postings. So if you know this, then you know what you are seeing. So now coming to what are the complications which you are going to see is what we are going to discuss. So the basic approach which we follow, that is a anat, physio and patho. See, anat, physiology and pathology. Based on this, we'll work out what are the complications which we'll get. Okay. See, here it's about two life. That is about the mother as well as the child. So, during the delivery, the major anatomy which I am interested is the pelvis of the mother, okay, and the head of the fetus. Okay. Now, talking with respect to anatomy, what can happen? See, if pelvis is contracted and the baby cannot be delivered, one condition is called as contracted pelvis. Okay, that is one of the complication which you will see. And if it's a contracted pelvis, that means if pelvis is contracted, then you have to do a C-section. Okay, now see, this is one condition. One more condition, if proportion you, if the proportion of head and the proportion of fetus is not in match, then it's called as cephalopelvic this proportion. Okay, see, understand clearly, CP is different from CPD. CP is always contracted, that means pelvis is always contracted, and you have to do a C-section irrespective of gestation, irrespective of the condition. But CPD differs because here the ratio might vary. Okay, in today's case, I mean in this pregnancy, the baby can be delivered normal, but if there is a CPD next time, then you have to again do the trial of labor. So if it's so in CPD, what happens is that in CPD, problem is ratio of fetal head to pelvis. So here, try for trial of labor. If failed, then you can go for C-section. Got it? Make sure you know that CP is different and CPD is different. That's it. That's the major thing which I want you to know. And also, if in the if this is not during the labor, if there is any intrauterine growth restrictions and all those stuff because of multifetal gestations, okay, then you can have IUGR. Okay, even that is diagnosed ultrasonically in the growth scan. But just saying, these are the complications. You can also expect IUGR. And also during this episiotomy which you give, you can have a perineal tear. Okay, the usual episiotomy is what degree tear? It's a second degree. And if you are injuring all your anal sphincter channel, it can be a third or fourth. So that can be also a cause. And also, if there is, this is the pelvis which I was talking about, and if you see the cervix part, if it's incompetent, okay, if there is cervical incompetence, that means length of the cervix is not proper, then you can have a preterm labor. Okay, got it? So this is, and if it's prolonged, if second stage of labor is prolonged, then you can have what? Obstructed labor. So the same thing here, which we see that pelvis anatomy we saw, and the same thing. Okay, the same thing which we have here. There is no point of discussing ovaries, fallopian tubes and all, because the baby is in uterus, and its course is after uterus. It has to go to cervix, then to vagina, and for this a bony pelvis helps in bony pelvis undergoes dilatation so that the baby gets delivered. So we have to talk about some conditions, some problems which occurs in the bony pelvis if it's not dilating, or if it's contracted, or if there is any problem in the cervix, which is something like which we discussed called cervical incompetence, which will lead to preterm labor, or if the second stage is prolonged, then it is obstructed labor. And during the episiotomy, where you can have perineal tears. So this is something which I need to talk about labor in anatomy. What happens in physiology is, if blood loss occurs. Why blood loss occurs? If there's an imbalance between what? Vasoconstriction and vasoconstriction, and if coagulation profile or any vasoconstriction is not happening proper, or coagulation is deranged, okay, and if fibrinolytic mechanisms are not proper, then it can lead to PPH. That's the most dreaded complication which an obstetrician encounters. So that is the major thing which I need to talk about in physiology. Okay, PPH. Then important, the complications which we discussed, GDM, that is gestational diabetes mellitus. Okay, that leads to what? Yes, that leads to increased insulin-like growth factors release, which will cause us macrosomia. And if it's macrosomia, what is the problem? It is difficult for delivery. So sometimes the baby might have shoulder dystocia. That is, if you are unable to deliver the shoulder, then it's after the head has been delivered, that is called shoulder dystocia. That itself is an important topic. Okay, so see, knowing just the normal statistics is not enough. Then what? Using your pre and paraclinical knowledge, what are the things which you can expect? Okay, see, all of the people who are watching these videos are mostly pre-paraclinical students, right? So for our person who's going to fourth year. So if they know what they have to watch, then obviously it will be useful for them to watch, correct me. Then again, all this cell injury, all those things is there, but I'm not discussing the pathological part of it, because that is something which is a chronic process. For example, chronic inflammation will might lead to abortion, all those things, which is not related to labor as such. Here we are talking with respect to labor alone. Okay, so I'm not discussing about that. If for example here in the anatomy I can discuss about what vacuum assisted. During vacuum assistance, if there is a hemorrhage, then you can expect all this cephalometoma, all those things. That's also something which is after delivery. I'm not even discussing about that part. Here just see what is the stats and what are the things which you can expect. That's the only thing which I am discussing right now. Okay, that's the only thing which I am discussing. And one more thing, see, there are various numbers here, I mean during your true pelvimeter. Remember only one or two numbers, that is 8 and 10.5. Okay, so if you know this, then I think it will be easier for you to, I will say why 8. See, there are 3 passages which has to be passed. We'll discuss that in next video, because that's something which I have to bring against few concepts there and then need to discuss. So after that I'm going to discuss that part. As of now, remember these two. Okay, so for today the video is done. So today we discussed about the labor room approach, which we know that only 2 types of labor can happen, that is vaginal delivery or C-section, though various others are there. These are the main things which you see and which are expected to know in an undergraduate level. In normal delivery, you can either have a normal vaginal delivery without episiotomy, or with episiotomy, or a assisted delivery, which can be further classified as vacuum assisted delivery or a forceps assisted delivery, both having different indications. Then you also have conditions when you have to do a C-section. C-section can be an elective procedure or an emergency depending on patient condition. And also we discussed about how the high risk pregnancies are being prioritized with the separate rooms, giving emphasis on that as well. Okay, then also we discussed about what are the various conditions which we can encounter in a labor room, keeping in mind mostly it is about anat, and in that majorly we discussed about knowing the anatomy of your maternal pelvis is important, and how essential it is to know the difference between CPD and CP. And also we discussed about the one of the cause of preterm labor, that is cervical incompetence. And also we discussed about obstructed labor, because if the second stage of labor is prolonged, that is called as obstructed labor or prolonged second stage of labor. Okay, then also that's the major thing which we discussed. And also in physiology part we discussed about the most dreaded complication, that is BPH. Okay, then also we discussed about GDM babies, where they can have a complication of shoulder dystocia. These are the things which are expected to know. That's it for today. Thank you.